Hey YouTube. So I'm back trying to recuperate. I had a surgery procedure done on Tuesday, and it was for precancerous cells on my cervix. Excuse me. So I am basically wanting to come on here and talk to you all because I stopped for a couple of years. Yes, years. Because I looked at my autoimmune disease and I seen a lot of stuff had changed when it came down to me. And I know you keep seeing me. Look up. The TV is on. And it's my show. I love my show. But so with this autoimmune disease, a lot has happened. From my last video, I have gotten pregnant. I have my baby. She's 3 now. She is very active. And now, because of the steroid use that they don't tell you about, because they really don't try to tell you, I guess, I have a collapsed femur head bone. So I need a hip replacement that my doctor does not want to give me. And there's no bone in the hip, the hip, no bone. But they don't see the pain that I'm in constantly. Also, what they don't tell you is that you are prone to cancers. So I just recently got the HPV vaccine because I have gotten the precancerous cells twice. In this last time, the first procedure I got was the LEAP procedure where they burn it. And this last one, I got it surgically removed. So hopefully, fingers crossed, Lord, we won't have it no more. And it's not a easy thing to deal with. I am still in pain. Because I woke up, they told me I was crying, and I woke up hyperventilating because my hip was in so much pain because of how I had to be in a certain position. So my muscles around my hip got inflamed. So I was in a lot of pain. And they was like, oh, we're going to keep you. Oh, no, you're not. I'm not staying in the hospital. But tell me what y'all would have done, because I don't like being in the hospital. When I first went in the hospital, I was in there for a long time. My pregnancy, I came out after 2 days. I was good, okay? So I try not to stay in the hospital because a lot of their treatments for me is steroids. That's their first, option. Oh, steroids. No, I don't want to take steroids all the time. Steroids is not something you want to do all the time. You don't want to always take. The side effects to steroids is very I want to say hurtful, because if it doesn't hurt you now, it's going to hurt you later. And it's to the point that sometimes it's not even just a physical, it's mental. It's to the point I had to change cars. I went from a Dodge Durango to a Scion XB because I got so much anxiety driving to the point where I would feel like my truck would flip. I'm thinking I'm too high up. I'm going to flip. When in actuality, no, you're not. but it's a mind thing. It's like your mind is overextended, so you're thinking past what is actually going on at that moment. What else did I want to say? I really just want to talk. If you have anything you want to add, anything you want to say concerning any autoimmune disease, we can talk. Let's talk. Let's get to know each other on this. Let's see what we can do as a community to help each other out, because it is so much out there. Nobody knows. Nobody can figure out what is happening, what is going on with each other. I'm learning that a lot of young people are having these autoimmune disease, and they're learning about them a little late. Some early, some late. But it's starting becoming a trend where a lot of younger people are getting autoimmune diseases. So please let me know what you're thinking. And also another question, because with my hip replacement, they want me to wait 10 years. So please chime in for me. Let me know, what do you think? How do you feel about getting a hip replacement so early? And then with the wait of 10 years, what are your thoughts on that? Do you think that 10 years is something that you would be able to wait for if you had a collapsed femur bone? Or is that something you are more likely, okay, I need to get that done now? Unfortunately, I do have to lose weight for it to happen. So that's a thing that I had to wait on as well. But let me know how you feel. Would you go ahead and get that femur bone, that hip replacement if you have a child? You can't do too much, can't get up. Doctor's telling you sit down because your femur bone is gone. There's no head inside your hip, to hold on to. So there's nothing there. So let me know what you would do. And let's discuss. So like, subscribe, comment. Let's just get together and let's see what we can do.